One of the questions patients will ask is, how often should I wash my silicone liner? I say whenever that silicone gel liner is removed from your skin is when it should be washed.
Right.
Oftentimes we'd say once a day, but if you're taking it on and off a couple times a day.
Right. The big thing being, if you're washing it multiple times a day, making sure that it's very dry before it's put back on your limb. Or having more than one liner and rotating them is also a real good strategy for that.
Which if you're wearing it for a shaping device, you probably don't have more than one.
Right.
But in that case too, something you can use to help if you have moisture in the liner and you need to put it back on, a little rubbing alcohol helps moisture evaporate.
I do suggest talking to your prosthetist before using rubbing alcohol, because there are some varieties of silicone liners that rubbing alcohol is not indicated for using, which wouldn't actually be a silicone liner. It would be a different type of material, but some of the materials are contraindicated for using rubbing alcohol on. But it is a good strategy, especially if it is silicone. Silicone is inert, and the alcohol doesn't affect it at all.
But the point being, it has to be dry when you put it on.
Absolutely.
I think we were talking a little bit earlier about people in other warmer climates and taking care of their limb. And the answer was, when your limb's sweating, you have to take it off and treat that liner and clean it and dry it out before you put it back on. You can't just continue to wear it because if you got perspiration in there, that's by heat and friction. So once you get some moisture in there, you're gonna start to move more inside of that liner, and then you're gonna get more movement, which creates more heat.
That moisture, it breaks the bond between the liner and the skin. So it creates an air pocket inside there, and the air pocket can easily heat up. So it's a self-fulfilling thing. As the liner starts to break away from the skin, it has more areas that can heat up, which is going to cause it to break away even more, and can go so far in dramatic situations to cause the whole prosthesis to slide off of your limb.